Hello everyone, my name is Maria van Kerkhove. I'm with the World Health Organization and I am the head of the Emerging Diseases and Zoonoses Unit in the Health Emergencies Program. I'm going to go through today a module around emerging respiratory viruses and give you an overview about what these viruses are and a little bit about transmission. By the end of this unit, you should be able to learn how viruses emerge, what coronaviruses are, who is most at risk from getting infected with coronaviruses, and how to protect yourself. If we look at the timeline of emerging viruses over the last several decades, we know that viruses continue to emerge and they pose challenges to public health. Some of these examples are severe acute respiratory syndrome coronavirus, which emerged in 2002 in China, the 2009 H1N1 influenza, which turned out to be a pandemic, the 2012 Middle East respiratory syndrome coronavirus, which first emerged in Saudi Arabia, and now we have a novel coronavirus, the 2019 novel coronavirus, which emerged in China in 2019. So how do these viruses emerge? So we know that human health and animal health are linked. And it's been estimated that between 70 and 80% of emerging and re-emerging infectious diseases are known to be zoonotic. And that means that they can be transmitted between animals and humans. And some examples on the screen here are avian influenza, which come from poultry, and MERS coronavirus, which come from dromedary camels. And there are many reasons why we are seeing an emergence of viruses. This includes things like population growth, climate change, increasing urbanization, and international travel. So what is a coronavirus? Coronaviruses are a large family of viruses which are known to cause respiratory disease, and these illnesses range from the common cold to more severe diseases such as Middle East respiratory syndrome, which is MERS, or SARS, which is severe acute respiratory syndrome. Where do coronaviruses come from? SARS coronavirus was transmitted from civet cats to humans in China in 2002, and MERS coronavirus was transmitted from dromedary camels to humans in Saudi Arabia in 2012. There are several known coronaviruses that are circulating in animals that have not yet infected humans. When a virus jumps from animals to humans, we call that a spillover event, meaning that the virus can be transmitted from animals to humans. So people at risk for novel coronaviruses are individuals who are exposed to the animal source, such as people who are in close contact with animals, such as working in a live animal market. Other people who are at risk for infection from human to human transmission are family members or healthcare workers who are caring for a person infected with a new coronavirus. So how can you protect yourself from infection? There are several ways in which you can protect yourself from infection. The first is to ensure that you wash your hands with soap and water or use an alcohol-based rub. And practice good respiratory hygiene, such as covering your mouth or nose with a medical mask if you're sick. Use a tissue or a sleeve or a flexed elbow when you cough or sneeze. And avoid unprotected close contact with anyone who has respiratory symptoms, cold or flu-like symptoms, and seek medical care if you have a fever, a cough, or difficulty breathing. When you're visiting animal markets, avoid direct unprotected contact with live animals and surfaces, and make sure that you wash your hands with soap and water after leaving a market. And make sure that you cook your food thoroughly before you consume them.